PCOD versus PCOS. What are the myths, what are the symptoms, and the smart treatment which we require.
Subscribe to our YouTube channel and press the bell icon so that you don't miss any important updates related to infertility.
Good evening everyone, I am Dr. Udaya, consultant gynecologist and infertility specialist from Indira IVF Gachibowli branch, Telangana. So today the topic for the live session is PCOD versus PCOS. What are the myths, what are the symptoms, and the smart treatment which we require. So basically PCOD, which is polycystic ovarian disease, and PCOS, which is polycystic ovarian syndrome, they are two common conditions. They affect the women hormonal health in a very bad way. But PCOD, whereas polycystic ovarian disease, it is having a definitive cause and it has a specific treatment. While PCOS, which is polycystic ovarian syndrome, it is not having any definite cause in the treatment. And many a times people are confused whether these both are the same. They are something like synonyms, but they are very different in terms of the causes of this, what are the symptoms, and what is the definitive treatment. So let us first look upon what is polycystic ovarian disease, like PCOD. So it is a medical condition wherein due to hormonal imbalance in the women, the ovaries will try to produce some immature or partially matured eggs during the ovulation time. And these immature eggs, what they do, they increase in number and they try to form many cysts in the ovaries. And whenever there are cysts being formed in the ovaries try to increase in the size, and they release a little amount of the male hormones. So that is the reason behind this PCOD. Coming to what are the symptoms of this PCOD, so patients might be having irregular menstrual cycles because of this abnormal ovulation. A little of weight gain will happen, acne, oily skin, hair thinning, fatigue. So basically the main factor of this PCOD will include the unhealthy diet and lifestyle. So hormonal imbalance also plays a major role in it, and the lack of physical activity will add upon to this, and even the stress plays an important factor. But whereas PCOS, which is polycystic ovarian syndrome, it is a complex entity which includes a lot of hormonal issues, some endocrinological issues, some metabolical issues, which not only affect the ovary, they affect the other systems of the body. So here what happens is, ovaries, they produce high amount of testosterone, and basically testosterone is a male hormone. So what it happens, because of this increased production of testosterone, the ovulation process is a little abnormal. It interferes with the ovulation process. Therefore, the egg is not released on time. And when the egg is not released on time, it will lead into formation of cyst in the ovary. And basically what is a cyst? A cyst is nothing but a fluid, a sac which is filled with fluid. So these male hormones, basically what they do, they form a lot of cysts in the ovaries, and these cysts get accumulated in the ovaries, and this might be the reason for irregular periods in the women with PCOD, and it eventually leads to fertility problems, especially in the reproductive age group women. So what are the symptoms of this PCOS? So PCOS will have severe menstrual irregularities when compared to PCOD. The menstrual irregularities are a way more, and the patients will be having excessively, like excess facial hair or body hair, which we call it as hirsutism. And apart from the normal PCOD, this PCOS patients will have like persistent acne and a lot of skin tags they have, and they will be having some male pattern type of baldness, and some darkness near the neck creases, near the armpits, and these patients are a little obese, and they have a difficulty in losing weight, and most importantly they have infertility issues. And these patients, they have a higher risk of going into diabetes in the future, along with some heart diseases. So when we see the prevalence of this PCOD and PCOS in India, so it is like 2.5 to 5% in PCOD, and whereas the prevalence of PCOS is around between 1 to 2%. But in recent times, this PCOS is on a increasing trend. So we have seen about what is PCOD and what is PCOS. There are a few symptoms which are overlapping, like which are common to both of them. So let us know what are the common symptoms to both of them. One is the irregular menses, and the second is a sort of acne type. But PCOD symptoms are very mild and they are like treatable, they are reversible. Whereas PCOS symptoms, so they are leading to a long-term complication, like I've told, like it might lead to diabetes mellitus in the future or any heart issues in the future. So basically, how are we going to diagnose it? So since we've seen what is PCOD and PCOS, what is the difference, we've come across like what are the symptoms. Now how are we going to diagnose these two things? So basically when a patient is experiencing like irregular menses, so what we advise the patient is to undergo of gynecological visit to the doctor. So wherein we get to see, when the doctor examines the patient, her BMI is taken into consideration. Apart from it, other systemic factors also we see, and we do ultrasonography of the pelvis, wherein we see in the ovaries if there are many number of cysts in the ovaries, and ovaries size is a little more compared to the normal size, and some hormonal blood test will be done to the patient, and if these all turn to be abnormal, so it shows us that the patient is having the PCOD. And wherein in PCOS, apart from the ultrasound examination and apart from the regular checkup of the patient, we advise some hormonal profile to the patient, like because in PCOS what happens, there will be a lot of testosterone, male hormone is dominated, so we do some blood tests to see whether there is any dominance of the male hormones in the body along with the ultrasonography. So now after knowing how we are going to diagnose, and after we got to know whether the patient is having this PCOD or PCOS, so how do we manage it? So management of PCOD, yes, it is a reversible thing. PCOD, because it is a milder form, yes, it is reversible, and especially with the proper diet, with proper physical exercise, and with the good sleeping habits, and avoiding any certain factors will lead to good results. First, when we come to diet plays a major role in reversibility of these symptoms. So we advise the patient, so whatever the diet, it is directly involved to maintain the BMI of the patient. So for a healthy female patient, the BMI should be between 18.5 to 24.9. In case if the BMI is exceeding more than 30, we label them as obese patients. So what we tell the patients, we advise the patients to take more of protein, like lean protein, like whole grain flours, like fiber rich foods. Some fiber rich foods are like sweet potato, pumpkin, some nuts, beans, and we advise them to take a lot of leafy vegetables such as fresh leafy vegetables, broccoli, some spinach and everything. So we advise the patient to cut down on their carbohydrates, like especially rice and sugars, and some changes in the diet, wherein we can replace the white rice with brown rice, and while cooking, oils also can be changed, we can try using some olive oil, some nuts oil, or some avocado oil, and consumption of fats like oil rich foods or dairy products or trans fats. What these do is they increase the body weight, so we can cut short on them. And even the pattern of eating also plays an important role in reversibility. Like it is better and always good to eat the food in small quantities in a more frequency than having a full large meal. And apart from these dietary changes, we advise the patient to take good amount of water to keep themselves hydrated. Like approximately 3 liters to 5 liters of water will help them to feel full, and it also helps to reduce the weight. So after the diet, one more important thing is the physical activity. So basically physical activity, what it does to the body, it reduces the body fat and it keeps the person active throughout the day. So, and when this energy consumption is being done, it will help to improve the immunity. It will boost up the pancreas to release the insulin. So ideally to the patients we advise to do regular exercise for around 30 minutes a day to maintain the ideal body weight. And some other physical activities also can be added, like yoga, dance, some workouts, cardio, like running and swimming, and they also help to improvise the periods regularity, and they help in resolving the fertility issues to some extent. One more thing is sleeping habits. So besides these eating habits, even the sleeping habits need to be observed to maintain a healthy weight. So what happens is the sleepiness in the daytime. It is one of the more common disorder for women who are having this PCOD or PCOS. So basically what we tell the patients is to avoid daytime sleep, and usually in the night they need to get an adequate amount of sleep, like 8 to 9 hours of sleep per day. So, and one more thing we advise these patients is, in case they are having any sleep issues, we advise them to avoid any products having caffeine, like coffee, like in the evenings, or to avoid any heavy meals at the night, or any snacks during the dinner. And even we advise the patient not to use any electronic devices during the bedtime. Apart from these, alcohol and cigarettes also need to be controlled. Like what happens when alcohol and cigarette consumption will be there, it produces a lot of number of androgens, and even tobacco consumption is unhealthy, and we advise the patients who are having PCOD or PCOS to restrain from taking alcohol and cigarettes. So what happens is they temporarily rise the estrogen and the progesterone levels. So there is a lot of hormonal disturbance which is happening, and it will indirectly affect the menstrual cycle. Apart from these lifestyle changes, when the patient we find that lifestyle changes they have done correctly, but still there are some medications to help to improve, to reduce the symptoms of these patients with PCOD. So over the counter many medications are available, like some of the patients will be needing some birth control pills, or some patients might be requiring some ovulation induction pills to help them to increase the egg size. And at least by taking these pills, what happens, the medication they help to regularize the menses, and on time the ovulation will happen, and which will in turn give a good fertility result. So not only this is related, since we have discussed PCOD and PCOS have a lot of issues with the hair also, like there is abnormal hair growth over the body, especially over the face, the upper lip, chin, and it is like a hirsutism type of feature. So what we do is there are some medicines which will inhibit the hair production, and there are some creams or like epilator, or we can manually taking out the hair, like waxing and threading, all can be used. And coming to the surgery, in case with the medicines also the PCOD is not getting corrected, yes, then surgery we need to do, especially laparoscopic ovarian drilling might be required for such a patient, but it is still under the results are not so satisfactory by going to the ovarian drilling also. We need to weigh the advantages and disadvantages, and in cases wherein everything has failed, then they require compulsory the fertility treatment. So basically fertility treatment with PCOD or PCOS, they include either ovulation induction, either an IUI, which is a artificial insemination, or an IVF. And IVF is the final and one of the best treatment for PCOD problems, because even though the medication do not work and the surgery do not work, and wherein the egg is not getting released on time, so what we do in IVF is the egg is fertilized with the sperm in the lab, and that embryo, whatever is being formed, will be transferred into the mother's womb for the implantation. Coming after knowing all this, like the symptoms we have discussed, how do we diagnose and how do we manage everything we have discussed, some patients have a few myths and facts, like I just want to clear them up. So many of the questions will be like whether PCOD and PCOS cannot be treated or they can be treated, what is the thing? So I want to clear upon this. So depending upon the symptoms and the early diagnosis, women with PCOS or PCOD, yes, they can be treated. But it is not necessary for every woman to undergo treatment, because diet and lifestyle changes can be done and they can control the hormonal changes in most of the patients. Okay, and the second one is, do women with PCOD or PCOS cannot conceive? No, it is not true. Women with PCOS and PCOD problems, they can get pregnant, but they need some sort of medication, some diet changes and some lifestyle changes. One more myth or fact which I wanted to clear is, losing overweight cures PCOD or PCOS. See, basically weight loss, some patients, you do the intermittent fasting, some patients go for keto diet. Yes, they are helpful, they will help to reduce the severity of the symptoms, but they do not treat the disease. So a reduced weight, what it does is it prevents from getting it worsened, like further complications might get prevented. And one more thing is, some patients have a dilemma, is PCOD a rare disease? When we see the global data, almost the 20% of the world's women population of the childbearing age are having or suffering with PCOS, and it is undiagnosed in most of the women due to lack of awareness basically. So many women, they feel discomfort in discussing about their periods, or it is considered as a taboo in many of the societies. That is the reason people think it is a rare disease, but which is not. So one more thing is, irregular periods are PCOD or PCOS. Yes, there are many reasons for irregular, heavy or missed periods. Like it might be some breastfeeding mothers do not get the menses, some thyroid disease patients, they get irregular menses, some patients with fibroids, or some patients who are doing the excessive physical activity, stress or extreme dieting. Yes, they also cause irregular periods, but these irregular periods are different from the patients who are actually having the PCOD or PCOS. Next, some questions we can take upon, like how do we cure PCOS naturally and get pregnant? Yeah, okay. Eating healthy diet and doing regular exercise and tracking the menstrual cycle regularly, it can help to cure PCOS naturally, and patients can conceive. Yes. Can I get pregnant with PCOS? Yes. With proper treatment for PCOD and PCOS, yes, patient can definitely get pregnant. Next one, how to cure PCOD problems permanently? Okay, fine. Basically PCOD cannot be cured permanently, but at least it can be managed with the diet and some lifestyle changes. That is definitely. Next, does PCOS increase the chance of twins? So basically what happens in PCOD is, because for the fertility issues, what we do is we use some sort of ovulation induction medicines, and because of these ovulation induction medicines, people might have twin, there are chances of twin birth. Yes. Best age to get pregnant with PCOS. Okay, the fertility age, it starts, the fertility levels basically, they start to decline after 30 years of age. So it is better to always get pregnant before that. And the next question, PCOD or PCOS, which is more dangerous? Okay, even though PCOS is more severe than the PCOD, both can be managed with treatment and some sort of diet changes also. If we do, obviously it will lead to good results. The next one is, yes, home remedies for PCOS. Yes, as we have already discussed, home remedies of PCOD are there, like daily exercise, at least 30 minutes a day of exercise, good adequate amount of sleep, like 7 to 8 hours of sleep, intake of iron or magnesium rich foods like almonds, cashew nuts, banana, or iron rich food like spinach, egg, broccoli, and required protein diet if we take, and avoid any processed food. These can also improve the PCOS. Next, the other question is, how to cure PCOS permanently at home? Okay, basically there is no permanent cure, but it can be treated at home with what I've told, the diet and the lifestyle changes, and some apart from this diet also regular exercise is required. One more question is PCOD versus PCOS caused by genetics? Yeah. Genetics can be a reason for PCOD versus PCOS, and a lot of research and evidence have also been put wherein genetics also plays an important role. Next, does PCOD versus PCOS cause infertility in women? Yeah, that is the basic thing. So what happens is infertility is caused due to irregular ovulation, because there are a lot of immature follicles which are being formed and not getting ovulated, or the egg is not getting released on time. So this is one of the major reason of causing infertility in these patients. So one more question is it possible to prevent PCOD or PCOS? See, basically there is no research proof for the prevention of PCOS, but at least we can reduce and manage the symptoms. Okay, so few more questions we have. So if anyone has any questions, you can feel free to ask. We will discuss them. So with PCOD or PCOS and obese, do we have to reduce weight to 60s or 50s to get pregnant? See, basically I have told about this BMI, right? So there is a body metabolic index, okay, body BMI, which plays an important part in telling us what are we exactly falling into. So ideally it should be somewhere between 19 to 24.9. Any BMI value which is within this range, so it will obviously improve the fertility chances. It is not that patient might need to get into 50 kgs or 60 kgs. Actually it depends upon patient's height also. So overall we need to see the BMI, not only the weight itself. So some take home points I would like to discuss about. One is see, basically whenever a woman is getting any irregular periods, or they are noticing some abnormal changes in the body, like if they are having this baldness going, or a lot of hair thinning is going on, or any excessive acne, or a lot of hair growth, abnormal hair growth, it is always better to visit a gynecologist. And especially if the periods have been irregular for more than 3 months, it is always advisable to visit a gynecologist and have a complete checkup. Okay, because ideally the better we see the symptoms, the early is the diagnosis and the treatment. So one more thing is, as we have discussed, yes, there are home remedies for this PCOD. Just minor changes, like minor changes in the diet, like exercising regularly, eating a healthy life, leading a healthy lifestyle. These also might help to improvise the PCOD condition, and which will have a good impact on the fertility outcomes. Next, some untreated things are there in PCOD, and some things are also untreated in PCOS. Suppose PCOS, if neglected, because it is a whole syndrome of a lot of endocrinological and metabolic issues, so the long-term complications are very more in PCOS. So timely intervention is needed. Because of the irregular periods, what happens is the endometrium lining tries to get accumulated and accumulated, resulting in like a heavy bleeding in between. So it might lead into some sort of endometrial carcinomas also, and long-term complications also are there apart from these cancers. So patients might have this abnormal uterine bleeding might happen, and they are more prone to have diabetes mellitus in the future, and some heart related diseases also they will be having. So basically the difference between this PCOD and PCOS is the hormonal imbalance, and if we try to maintain the hormonal balance, then it is easily reversible. So yes, even with the PCOD and PCOS, it is possible to get pregnant, because nowadays the advances in fertility treatments have improvised so much that even with the bad PCOD or PCOS also, patients are able to conceive and get pregnant and have a healthy baby with them. So my suggestion is, any female observing any of these symptoms which we have discussed, irrespective of doing a healthy lifestyle changes, taking good amount of medications, and still not able to conceive, or if you are still confused between what is actually, where am I falling, or like am I having a PCOD or a PCOS, or if you have any queries, you can definitely reach out to us. We are there to help you. Yeah, thank you so much.